News at 8 starts right now.
It's 8:15, all new this morning. The demand for cosmetic surgery is at an all-time high, and it's not supposed to decrease with the economic downturn.
Yeah, in fact, minimally invasive procedures still on the rise as surgical procedures are at a standstill. Dr. Tina Alster is with us now to discuss the trends she's seeing in her practice. Good morning, Dr. Alster.
Good morning.
All right, I'm not big on pain, so what are the most painful cosmetic procedures so I can avoid those, definitely?
Well, you'd want to avoid going under the knife, which would require some anesthesia in an operating room. But in terms of those procedures that I do in my office, which range from filler injections to Botox to freeze lines or fill lines to laser procedures, we can actually use topical anesthetics to reduce the pain associated with these procedures. The latest one is called Pliaglis, which just got FDA approval, and it's fast and effective, and my patients love it because they don't even feel the insertion of the needle at all.
Well, we mentioned that the cosmetic surgery is at an all-time high, not expected to have a downturn with the economy. You would think that this would be one of the first things to go. Why are people still doing it during these hard times?
Well, I think that people think that if they look better, they feel better about themselves. Many of the procedures that we perform are not only safe and effective, but they're not terribly expensive either. And most of the results that we get last for several months.
So expensive as in how much are we talking? Because what's expensive to some folks may not be expensive to others.
Well, most cosmetic procedures in the past have run into the thousands of dollars. What we're talking about are procedures that run in the hundreds of dollars, oftentimes as little as $300 to $500, depending on what it is you're having done. Many of the procedures are actually related to how big the area is that somebody's getting treated. So, for instance, if you have a small tattoo, the price would be much less than if you had a huge tattoo.
So what's hot right now, Dr. Alster?
Yeah.
What's everyone asking for? Which procedure?
Well, everybody wants something that's quick, safe, and effective. And I think that over the last 5 years, what we've seen is an increase in the number of filler injections like Juvederm and Restylane and Radius, as well as Botox. These are by far the most common procedures asked for in virtually any dermatologist or plastic surgeon's office today.
Now, we see on our screen right now some sort of white topical going onto a frown line.
Yes.
What is that we're looking at?
Well, that is the latest topical anesthetic that got FDA approval called Pliaglis, and this has revolutionized my practice. If you put this on and leave it on to dry for 20 to 30 minutes and then peel it away, patients don't even feel the pulse of the laser or the injection of a needle, making these procedures virtually pain-free.
Let me guess, the baby boomers are really coming to see you right now.
Oh, absolutely. This has been a trend we've been seeing over the last 10 years. And not only are they coming in droves, but they want it yesterday. They want to have something that they can go out and face the world right after their procedure.
And which stars do people want to look like? Like, whose lips do people want? Whose eyes? Whose cheeks?
Well, a lot of people that I see, I'm in Washington, D.C., you know, they tend to not go for the movie star look. They tend to go for the politician look, for better or worse.
Really?
Yeah, I mean, most people aren't asking, a lot of them say that who they don't want to look like. They don't want to have a big, fat, red nose. They don't want to have a big mole on the side of their nose. They don't want to have big, ugly lips. But for the most part, people come in and they don't ask to look like a particular star. What they want is a more youthful version of themselves, which I think is a realistic expectation.
So they're not coming in saying, I want Nancy Pelosi's lips or something like that.
No, they're not asking that, but a lot of them will comment on how good Nancy Pelosi looks.
She does look good.
Okay. That is very interesting. Politicians, okay, all right.
They are the new stars.
Okay. Dr. Alster, thank you so much for all that information. Have a good morning.
Well, thank you very much. Nice talking with you.
Coming up on The Morning News.